Welcome to the Earn Your Marks podcast, presented by Pro Exam Tutors, the only podcast you need to pass the CFP exam and become a certified financial planner professional. Here's your host, Sev Meneshian.
Welcome to the Earn Your Marks podcast. I'm Sev Meneshian, certified financial planner, practitioner, lead tutor, and the founder of Pro Exam Tutors. Now, in this episode, we have a very special guest who I know many of you have been waiting very patiently to hear from. Dr. Bianca Busch is the founder of the College Psychologist, and her practice specializes in mental health support for college students and professionals, just like you, that are preparing for exams like the CFP exam. Now, she was trained at the University of Chicago, so like in my backyard, and Harvard's Boston Children's Hospital, my brother's former backyard. And Dr. Busch employs techniques such as psychodynamic psychotherapy, which I have no idea what that is. Okay, but we're going to find out from Dr. Busch likely, and cognitive behavioral therapies to tackle anxiety, depression, and test-related stress. Now, her book is called Test Anxiety No More, which you guys definitely should check out. And it's particularly relevant for those facing the pressures of professional exams, it offers strategies and insights to manage exam fears effectively. And lastly, at her practice, Dr. Busch, her approach is designed to help students and exam candidates not only manage their mental health, but also excel academically and personally. So with that, as mentioned, Dr. Busch, we're very excited to have you on the Earn Your Marks podcast, and thank you so much for being a guest today.
Thank you for having me. I'm so glad to be here.
Awesome. Well, I over the years of teaching and tutoring, one of the familiar things that I and the other tutors here are hearing is like, I'm like, I have to pass this exam. It's driving me nuts. I want it out of my way. I'm, uh, my job will go better if I get it, or, I'm pregnant and I'm due in 2 months and I've got to get this thing done before the baby, so like all these things are happening. What they're all leading up to, of course, is what I guess is, and from a layman's perspective, I just call it test anxiety, but I think more other things are going on. So first question I just want to go over and talk about is, what exactly is test anxiety and let's say general anxiety? Like, is there a difference between the two, or are they closely related?
Yeah, so some people who have general anxiety will also have test anxiety. And so when we're thinking about this, everybody has some level of anxiety, and that's normal, right? It's really our body's nervous system getting us ready for a threat. So if you see a lion, if you see something big and scary, your autonomic nervous system is going to kick in. You're going to get sharper. You're going to be ready to run. Okay, that is normal. But sometimes we get this response from normal things like tests or that kind of thing. And it can prevent you from thinking clearly. It can prevent you from being ready for your exam. So general anxiety is when people have worries about kind of everyday common things. People are worried about the weather. People are worried about what's going to happen tomorrow. People may even be worried about what's going to happen in 10 years. And so test anxiety is really specific for tests. You may have it only for certain tests. And what happens is, as you're either preparing for that test or you go to sit for it, you start to have a physical response. Sweaty palms, sweaty pits, your mind's going blank despite having prepared for hours and hours and hours, which I know your students do participate in your program because the exam is so intense and covers so much information, right? And so they've been preparing for months. And they get down and they sit down for that exam, and it's like they haven't had any preparation at all, or they can't access it. So that is test anxiety. You have prepared, you sit down, and the information seems like it's gone. Sometimes test anxiety can start even before then, where you're thinking, and people, you told me that the pass rate really changed when they changed the structure of the exam. And so if you're a person who has failed the exam once, the anxiety can get in the way of you preparing to in the way of you preparing for the exam, take the second time or the third time, because you have this anxiety that's like, well, I didn't pass. Am I going to pass again? I don't know. Is it even worth studying? And so all of that can sort of play into someone's mind if they're taking the exam for a second or third time. Um, Test anxiety is not a DSM diagnosis technically, but that doesn't mean it's not a real thing. People experience it, and the good news is that there's something that can be done about it.
Good. All right. So it seems like, okay, my understanding of anxiety is like, me, you, and everybody else, our ancestors, whatever, million years ago, we had to run away from that hungry lion or
Mhm.
lions, God forbid.
Yes.
But we really don't have that threat anymore.
Mm-mm.
The biggest threats, let's say, maybe getting, God forbid, in a car accident, or it may be very rare, but maybe getting, attacked or something like
Mhm.
that. But that's like not like a everyday thing. Whereas our ancestors a million years ago, that's probably, I'm just guessing, every day something maybe that they
Mhm.
had to deal with. So, but we still have that. It's built into the hardware or software, whatever you would call
Mhm.
it. Okay, so when I'm getting prepared for an exam, and let's just say I'm not on exam day, but it's in the months or even the year leading up to it,
Mhm.
getting the sweaty palms and whatever,
Mhm.
is in the back of our minds is what's going on is this is what is happening is okay, if I fail the test, then I'm gonna get eaten by a lion, so to speak. Is that
Mhm.
somewhat, even though that lion could be, I just have to take this thing again. Like that's what's really happening.
Yeah. Well, absolutely. So people are thinking about what are the consequences going to be if they don't pass the exam, right? So your mom who's pregnant is going to deliver. If I don't pass this exam now, when am I going to be able to take it again? I'm going to have a newborn. So how can I study for this exam? And I learned from you that the exam is only offered certain times.
Mhm.
So you have, someone's mind can start to do something that we call catastrophize, or to think about the absolute worst case scenario. I'll lose my job. If they're depending on passing this exam so that they can get a promotion or earn more money. If I'm not able to do this and I can't earn more money, then my family may be in peril or my personal finances may be in peril. So it's really thinking about all of these long-term scenarios. And some of them, can be really detrimental. And then some of them, the way that anxiety works, it can play a trick on your mind and make it feel like
Mhm.
it's a lion, even when
Oh,
it's like it's a surmountable thing, right? Because at the end of the day, it's like the stakes may not be as high. It may be like, all right, if I don't pass it this time, I'll take it one more time. And
yeah.
that sounds pretty simple, but the mind may play a trick and say, oh my gosh, if I don't pass it this time, will I ever be able to pass it?
Oh, yeah. Or the frustration comes in is that like some students when and I don't want to just talk all about not passing it or just if really, some
Mhm.
students when they go into the exam. And let's say there's a bad outcome. I've talked to plenty of students where it's like it seemed like they just got back from like a walk in the park.
Mhm.
They're like, whatever, I'll just take it again. But a majority of students that haven't passed once or twice or three or four times, I mean, I can hear it within the first 5 or 10 seconds.
Is that right?
Yeah, it's just like you can just tell something's there. Now,
Mm.
if it's that one out of 10 people who's like, yeah, I failed and I could have prepared better. I'm just gonna take it the next time.
Uh-huh.
And so when you get two different types of people, and I'm probably saying it wrong, but is that how we're hardwired, or the software
Mhm. Mhm.
for me is going to be, obviously it's going to be different than
Yes.
any other person, but
Yes.
person
Yeah.
seems
So
like
when
a
you,
fighter pilot, it's like,
yeah.
cool, no problem.
Yeah. So we know that about 40% of students, and the studies are done in college students or even grade school students, but we can extrapolate to adult learners. 40% will struggle with some test anxiety. So that's not everybody. That's 60% of students who are not, right? Who can
Yeah.
just come away and sort of coolly and calmly say, I'll take it again. And so you're right, people are hardwired in a different way. And these are going to be the people who are more prone to have things like generalized anxiety disorder or phobias or OCD. And it's just a part of their genetic makeup. I
Okay.
work with all ages. And so if I'm working with children or young adults who have anxiety, it's often the case that their parents will have anxiety, and I'll get to have some contact with them. So it really is something that can be hardwired in us. It can be something that develops over time, right? Someone may have not been an anxious test taker in high school. Things were very easy, but then in college, they developed an anxiety because they were faced with much more difficult exams. Or maybe
Oh,
it comes later in their profession when the stakes are higher. So if it's someone who is in medicine and they have to take board exams, we cannot progress to the next level until we pass those. That has a different weight than, your end of semester final. So it could be something that is just really inherent and genetic and biologic, and then it can also be sort of a response, almost kind of like a trauma response, if you will, if you've had poor test results in the past, or you've failed, or you've had difficulty in the past.
okay. So maybe a student that has done okay, because I hear this also, is like,
Hmm.
I passed all my exams in college. Now, most students
Yeah.
take the CFP exam. There's got to be a stat out there, but I would say like the average time out of school is like 10 years.
Uh-huh.
But so if you get younger students, that's early to mid 20s, they'll be like, oh man, I didn't pass this exam. Uh,
Mm.
I did well on all my series, licensing. So for
Hmm.
our industry to give advice and so on, you have certain licenses you got to pick up or a
Mm.
license you have to pick up. They're like, I aced all of those, no problem. But when I got to the CFP, man, I've never gotten I haven't struggled this poorly.
Huh.
And I'm just wondering if it's like when you finally, not finally, but if you do have a bad experience, if that can, let's say, ruin you to a degree for some time, or can also just having nothing but positive experiences, and then you get slammed on a test like your medical exams or the CPA or
Mhm.
CFP, and does that shake somebody or,
It
um,
can.
yeah.
No, it absolutely can. I see this with college students who had a really easy, breezy high school experience. They didn't have to study. And then they get to college, and depending on where the college, I mean, this is kind of my story, right? So, public school in Albuquerque, New Mexico, my public school, fantastic, go Knights, but not the best school in the city. And then going to the University of Chicago, which is like mind
Yeah,
blowing.
which is yeah, that's
Yeah, and I was just, blown away. And so was this confident high school student ranked at the top of my class. And then, of course, this is a very common story. People go to college and everybody's very, very smart. People have gone to Illinois Math and Science Academy. They've gone to
oh,
various boarding schools. And
oh,
so you're now competing with people who have had exposure to different kinds of things. And boy, was that difficult. Um, you
I
know,
can imagine. That's got to be um not a wake up call. What's the word I'm looking for? Yeah, it's just tough because then, or it's
Yeah.
I make because I'm huge into sports, following, playing, and all that
Uh-huh.
stuff. It's like if you take somebody who was at the top of his or her whatever, whatever sport, but
Yeah.
baseball, and now you dump them into. I think you mentioned that your husband's from Minnesota. I think they actually
Uh-huh.
have a pretty robust college program, and a couple of the programs out there, which is weird to me because it seems like it's always super cold up there. Now it's like you're at this different level. And the reason that
Yeah.
resonated is that my nephew recently got a baseball scholarship
Oh.
and I forgot the name of the school in Minnesota, but
Huh.
he said something similar. It's like
Uh-huh.
everybody up here was really good in high school.
Yeah.
High school, he goes, there was a good handful of of us
Yes.
performing well.
Yeah. So, I mean, it's going to be a similar thing for your students, right? That they have passed
Mhm.
all of, you said those sort of series, those different exams, no problem. But you get to the CFP and it's a different level of testing, it's a different level of knowledge. And so
Yeah.
that can be really intimidating even when they're studying the material.
Oh,
But
totally.
then if they take the exam and don't pass it, it can be like, wait a minute, what? I am the person who always achieves. I am the person who always passes the exam and is at the top of and I didn't pass this exam. It can be a total shock to the system.
Okay, so like a boxer or a mixed martial arts fighter, any that they go in, they've enjoyed nothing but success. They
Exactly.
finally get knocked out,
Yeah.
and I that has to change the way that they think, and maybe they
Oh,
get
yeah.
right back to it, but it does probably set
And
you back.
some people will use that as motivation. They'll say, oh, this CFP exam's not going to get me.
Mm-hmm.
Right? And then some, they depending on sort of who you are internally and the way that you're built, for some that can turn to, oh, well, am I really good enough to pass this exam? Can I
Okay.
be an advisor? And they'll start to question their ability to actually do the work, to pass the exam and, can they do the work if they pass the exam? So it just depends on a person's internal makeup and who they are, how they deal with this failure or the setback.
All right. So now you mentioned something before that I think a common what's the word I'm looking for? But let's say there's something common that happens with anxiety in general is that somebody might get sweaty palms or something.
Mhm.
Okay, for test anxiety or leading up to the exam, are there any other signs that students might be looking for? Is it like I think one of the things you said is almost like the not the brain shuts down, but
Mhm.
you have more trouble thinking if you're a little bit
Yes.
up. Is that
Yeah, so your mind might go blank, right? You might get to a question, you've reviewed the material that's relevant for this question, and you're like, oh my gosh, I can't believe I can't think of this answer. I know I know it. I know I absolutely know this, but I can't think of it, right? And so what happens with sort of the physiologic response is that in the normal way that we're supposed to be getting ready for a lion, your brain is clearing space so that you can be prepared to run and
run or
get
fight?
away from this attack, right?
Yeah.
And so that's like maladaptive for a testing setting because you need to recall that information. Or your mind can just get sort of scrambled up and you're like, I think it's this, I'm not sure. And you're switching between A and B. Is it A? Is it B? Is it A? Is it B? Right? And so you're just not thinking as clearly. So that's like a cognitive symptom. So, in terms of physical symptoms, you may have stomach upset, right? Leading up to the test, you can't get out of the bathroom
Okay.
because your stomach is just upset. You may have your heart rate is beating really fast, and you're like, oh my gosh, am I having a heart attack? Like my heart is beating so fast. So there could be all of these like physical symptoms that happen that can distract you from being prepared for the test. And again, these things would be adaptive if we're running from a lion. You need your heart to pump fast to
Oh
get
yeah.
blood to your extremities so you can get out of there.
Yeah.
But we're going to sit down at a standardized exam testing center where you're going to be still in front of a computer, maladaptive. We don't actually need that.
Okay, so can you and I will guarantee that I had those things and I probably had, all these things. I just didn't maybe pay attention or was
Mhm.
focused on the exam. If I'm tuned into that stuff,
Yeah.
and of course, just for everybody listening, Dr. Bush is here to just give, some general ideas.
Right.
She's not going to be giving medical advice. That's not what we're
Yes.
doing here. But like, are there things that if I sit down or if it's before the exam, which everyone, 100% of the people are going to be nervous, are there
Mhm.
things that where if I notice I'm shaking a little,
Mhm.
palms are sweaty, or maybe I'm just sweaty, can I do
Mhm.
anything to calm down if I'm not under the supervision of a medical doctor who is
Right.
prescribing some sort of anti-anxiety, which I guess we can talk about.
Yeah.
But what can
Yeah.
someone do?
Right. So, like I said, the good news is that there's something that we can do about these symptoms. There are really good evidence-based techniques that we can use to get our body ready and prepared to take the exam, to take it out of the fight or flight mode. And so that's what I write about in my book, Test
Mhm.
Anxiety No More. It's combining all these things. And so There are things that you can do with your breathing pattern that will help you come back into yourself and be ready for the exam. There are different sort of mental exercises that you can do even before you walk into the exam that will help you feel calm as you're getting ready to sit down and do things. And then, like I said, the exciting thing is that we have studied these things, we have tested them, and they work.
Nice.
Now, do they work overnight? No. And so that's the thing, if someone is experiencing this anxiety, I recommend dedicating as much time to working on the mental as you are getting the content. Because these techniques aren't something that you can say, okay, I'm going to try to practice breathing the night before the exam, and then you can implement it the next day. You really have to spend some time practicing these things, but they work. If you
Yeah.
practice them, they do work. So that's in terms of sort of calming down your body. Because what you really want to do, if your sympathetic nervous system, that's responsible for the fight or flight, that's what gets your heart rate going, gets you sweating, gets your stomach rumbling. We want to
Okay.
counter that with the parasympathetic nervous system, which helps us rest and digest. And
Oh,
so the way that we can do that is sort of using and practicing these techniques, the breathing, other mindfulness things that we can then enact in the moment because we have practiced and we're ready and we can say, okay, it's time for the body to chill and we're going to do these things and sort of bring that response down.
okay. So when you slow your, let's say if you slow your breathing down, which
Mhm.
I've heard that a lot, are
Yeah.
you just very strongly signaling to your brain like, hey, we're not being chased.
Yes.
This is how we breathe,
Yes.
settle down. Like, uh,
Yes.
I have I have enough money or I have enough food today. I've
Yes.
always had enough money or food, and I'll have more than enough in the future.
Yes.
So just like shut up for 5 seconds and let me think.
Yes.
Like let me think through this
Yes.
problem. That's
And
not
the
a
way
good.
that and the way that we do that physiologically is so again, talking about we have to access that parasympathetic nervous system. One of the things I teach in my book and in the program is that we have to do something called diaphragmatic breathing, right? The diaphragm is sort of right underneath our ribs,
Mm-hmm.
helps us breathe very deeply, helps us get good oxygenation in the lungs, which then provides great oxygenation for the body. But when we activate the diaphragm, we also trigger the vagus nerve. It's getting a little sciencey, bear
Oh,
with me,
that's fine.
but triggers the vagus nerve, which then triggers the parasympathetic nervous system, which again is that one that's responsible for the rest and digest.
So like sympathetic, no good. Parasympathetic, well, it's
Exactly. Exactly.
skydiving and whatever stuff like climbing mountains and running.
Yes.
Parasympathetic is like exam. That's the
Chill.
exam mode we want to be
Yeah,
in.
that's exam mode. That's what we want to access.
Is
So yeah. So you
okay.
just set up a whole chain of events when you can do that, when you can access that breathing. It can help with clearing your mind so that you can access all that material that you've spent months putting into your brain. You know,
That's the part is that when students go in and they're just unsure if they're going to pass, which is I think 100% of the students, and there might be outliers here and there.
yeah.
100%. I always mention too on initial calls or tutoring sessions or whatever when I'm doing my review courses, one of the first things I'll mention is that, guys, listen, you're not going to feel comfortable going
Hmm.
into the exam. You're just going to be nervous and you're just
Interesting.
going to be anxious.
Yeah,
It's like I always say that so that students will be like, well, oh, I'm like not the only one that feels
that's
that.
great.
Yeah, but what I'd like to follow up with is say, look, you're not going to feel normal going in. Okay,
Yeah.
you're going to be amped up, but you can at least reduce or greatly eliminate the
Yeah.
sensations that you're feeling by, for example, deep breathing or is there anything too, and I know it's a practice thing, but
Mhm.
if someone starts studying, typically a student will start studying like a year out. That's
Okay.
2 years is the sweet spot.
Wow.
Um, is there anything to, like if you close your eyes or you think for a few minutes a day and you
Mhm.
actually
Mhm.
tell yourself you're a CFP, not saying I
Mhm.
am going to pass, be like,
Yeah.
I am a successful pass. I
Yes.
passed the CFP. Is
Yeah.
that working into
Oh,
the
absolutely.
aesthetic thing?
Yeah, so we call those, manifestations. That's a mindfulness technique where
Oh, okay.
it's utilizing visualization as well.
Okay.
That you could see yourself. You can see yourself. You see your email signature with these letters after your name, or that kind of thing. It's really, really powerful. And I'll
Okay.
give you one story. A physician that I worked with had a difficult time passing her board exams and had failed them several times. And one of the things, this is in my one-on-one work, one of the things that I did for her was I printed out a picture, or yeah, I printed out a picture of her. It was like a manifestation card, and it had her
Hmm.
name and then her board credentialing when she would finish, and had her sort of post that at her computer so she could see that every day. That's what
That's
she was
amazing.
working towards.
I
Yeah.
mean, that's what she's looking at all the hours that when she's at her desk. So,
Yes. And then to say something, one of the manifestations that we came up with was that she is already functioning in the capacity of a board certified physician. And this test will just be something that not necessarily proves it, but
mhm.
solidifies it for colleagues, right? So those manifestations, the visualization, again, something that I review in the book and in the course, they are so powerful. And I'm like, oh my gosh, if you start doing those a year out from the exam,
Oh,
you'll really be getting yourself in a good mindset.
because it's like calming you down because you're putting yourself there already. It's not like it's something that's out of reach. And
Right.
so if I want a new car, if I just picture myself for the next 2 months driving this thing, I mean that
Yeah.
car almost has to be like not brought to me, but I'll
Yes.
go to it, or we'll kind of
Yes.
intersect in the fabric. So it's interesting.
I love
Interesting.
that.
That's very interesting. So now a student is in the exam, and now and let's say uh okay, let's say the first usual, or it's like this with me with other
Mhm.
exams, or all exams I think I've taken, or performing in sports, whatever it happens to be. Once you get into those first couple or a few 5, 10 questions, it's like you then forget about the anxiety. But what
Uh-huh.
if it creeps up? So there's a 6 hour exam. Now I'm 4 hours into this
Uh-huh.
thing,
Uh-huh.
and now it starts to creep up again. Or I've come back from my lunch break, and man, I just like I want to get this thing done and over
Uh-huh.
with.
Uh-huh.
And so I've got the breathing down. Maybe there's some self-talk or visualization. Is there is there a quick little hack that students could do? Like I heard
Mhm.
pinching your between that fatty
Uh-huh.
part between your thumb and the
Uh-huh.
forefinger works, but I also heard that works for nausea. So I don't know
Yeah.
what's true.
Yeah, that's actually I have I reposted a TikTok of like holistic psychologists doing the pinching thing to sort of calm yourself down or access some relaxation. So definitely, and this is common, the reason why I'm so passionate about this topic is because I have experienced it myself, right? And so the last board exam that I took, um, there was a section on some material that I can't even remember what the topic was now, but I hadn't reviewed that specifically. It was like criteria for some diagnosis, and it threw me off. And so I took my break, and you can say, "Oh my gosh," that train of thought can start to set in. "Oh my gosh, I didn't know this. Am I going to pass? Am I going to pass?" So I always recommend, taking a break at that moment if you can, if you've allotted time for yourself to sort of
Okay.
regroup. You can engage in some of those manifestations. I also teach grounding techniques, which really can take you out of your head, out of that those future projections that am I going to pass, am I not going to pass, and bring you
Mm,
right back to the present moment. Because that's
okay.
what anxiety does. It can take you way down the road. Um,
Yeah.
and you're thinking 10 years ahead when you really have got to be back in that room, focused, and to finish that last 2 hours of the exam, if you're at hour 4 of the 6 hour exam. So grounding techniques can be, there are so many different things that you can ground, but the point to ground, but the point is that you're bringing your body back to the present moment so that you can tackle the task at hand.
Okay. All right, yeah. So that in you have the time. Of course, it's a 6 hour exam. This I have actually somewhat of a selfish question,
Yeah.
which okay, so when I took the exam, and I'm trying to figure out how the heck this happened. So I had been studying for a whole, let's see, it was a 10, I did an accelerated. So it was like a 10 months. I was studying almost 11 months. But the week before the exam, I sat down. At that time, I wasn't married, no kids, no dog, nothing like that. So it was a peaceful, and I put aside the whole 10 hours. So 4 hours on a Friday, 6 hours on a Saturday. They changed the format down to six, but the only
Okay.
reason I mentioned that because it was like a longer exam.
Yes.
I took a practice exam full blown on that Friday and Saturday, week before the exam. And I scored in the low to mid, I think like a 63 or 65.
Okay.
I turned around and took the exam, and I was so deflated. I really was.
Mm.
Like what the hell? Like I just studied for 10 months, um, made all these sacrifices,
Yeah.
getting 63, 65. Now the week later is the exam, and obviously the results were positive. How does somebody go? Well, both ends. How does somebody go from not a great score, not the worst in the world, they got
Hmm.
a mock exam and then pass? And then the second part of that question is how do we have somebody that gets like an 80%, 90%, and that's probably not that high, but let's say about 80% on a
Hmm.
mock exam,
Hmm.
and then fail the exam? Like
Hmm.
what is happening there? And I know it's
Interesting
impossible for you to
question.
say, but I was just more curious about what you
Yeah.
think would contribute to the success on one end and then the failure on the other
Yeah.
thing.
Those are good questions. I mean, I have some hypotheses. But question for you before I answer that, what is a passing score or what is a good
Yeah.
score?
Yeah,
Oh
no,
man.
nobody knows. So, but and just because what is it? It's the modified Angoff system, which I don't know exactly how it's graded, although it's not a mystery on how the
Hmm.
CFP exam is. It's just that how that is determined, I think, is a little bit of the mystery.
Okay.
But
Interesting.
yeah, but let's just say, just for
Sure.
the sake of argument, hey, if you get 7 out of 10 of
Yeah.
the 170 questions correct, you're probably good. You're probably
Okay.
good to
Okay.
go.
Okay. Okay. Okay.
But just in
Hmm.
case, if the board or anyone's listening, it's not a 70% pass. We actually don't know that.
Yeah.
But yeah, how do you, I mean, I guess,
So a couple of hypotheses. For the person who had poor performance on the practice exam, but then went to pass the actual exam, one,
Mhm.
um, I wonder if there was something that they did between the week of the practice, and this is for you, the week of the practice and the actual exam. Maybe there was a motivation to, oh, I got to brush up on this area or that area, and some transformation happened in that last week. I don't know if there's enough time to make a big difference, but I wonder if that's a possibility. You wonder about the logistics of the practice exam. Was it really representative of what was on the actual exam? I don't know about the composition of the practice versus the final. I don't know if the
Yeah.
composition of the actual exam changes from exam to exam, which is, in medicine is the case.
Hmm.
So those are the things that I wonder about. I wonder if, you know, the thing that I don't know that I actually mentioned is that the anxiety can be helpful as long
Uh,
as it doesn't take us to a place where we cannot focus. And so I wonder if the anxiety of the real exam had you in a mental space that was just sharper and more ready than when you're taking the exam at home. So that can be possible too.
okay.
Um, and then for the person who did very well on the practice exam but didn't pass the actual exam, sometimes that's when I really start to wonder about the anxiety, right? Because some people will call it a test block. Some people don't have the language to even call it anxiety. They're like, something happened. I felt like I was ready, and then I got to the exam and I wasn't as I it didn't feel the same as when I took the practice. And maybe they
Hmm.
just don't have the language or understanding of their body to realize that they weren't thinking the same way that they were on the practice exam or something like that. So I really wonder about that. I wonder about did they, when they were taking the practice exam, were those conditions really similar to the actual test conditions? Did they take more breaks? Was it
Okay.
quiet in their home, but not quiet in the testing center?
That,
And that
that
was
can happen.
difficult.
That can most definitely happen.
Okay.
You can get an annoying, and I don't know if that's the case with this particular group of students. But yeah, you can probably get in. I know they give you the big, like the big earmuffs, like you cannot hear anything, but who knows? There could be a little like ticking sound, or someone's got the sniffles and you can still hear it, and that can totally throw you off. Because there have
Yeah.
been only a handful, thankfully, of students that I've worked with where, and there's one woman in particular was like, I mean, I was just peppering her with the toughest questions, session
Yeah.
after session. She was not, she was not missing a thing.
Yeah.
Generally, gets to the exam, she's like, I failed it for the second time, and I don't think that she's taken it again, which is a shame.
Oh
But
no.
no, I mean, there was another guy that was very similar. Like they were not missing anything, and there's no like, there are no easy, layup questions, but I was taking it like 10 steps further. Like I was,
Wow.
we'll never be able to answer these, and they were hitting them like it was nothing. Like they should have been teaching.
Yeah.
Both of them came back
So,
with poor results.
so another thing that happens, and this is, again, not medical advice, but putting on my psychiatrist hat,
Mm-hmm.
people have different ways of learning. People have different ways of regurgitating the information, right? And so you have told me that you're orally testing these people. You're giving them questions, or was it written?
Well, it's like what will happen, typical tutoring session. It's like
Yeah,
we're not going over notes or slides or something like that.
yeah.
Let's go over these questions. So they'll read the question. I'll actually, the
Mm.
other I and the other tutors will make them explain the information to us.
Uh-huh.
They're teaching the teacher, the old psychology.
Yes.
And so and that's the most difficult thing because what we're really doing is trying to listen for like those three, four, five things that the student needs to know. And these two individuals were just on it. Like there was nothing I
Yes.
could get past them. And
Yes.
it was disheartening because like she
Yes.
had taken it before, he had taken it
Yes.
before.
Yes.
You guys have been through it already. You know everything.
Yes.
What is going on?
So, yeah, and I see this often too, right? So if everyone has a different learning style, everyone has a different way that they process the information. Some people are auditory learners, some visual, some read write, some are kinesthetic, they've got to move around. This is a topic I cover in the book, and I actually have a quiz that people can take to figure out like what are their dominant learning styles and really monopolize those.
Uh,
But some, if the exam were oral, they would
mhm.
pass with flying colors. Some, if the exam were, it's just if it were oral, they would not because they're not very good with oral
Yeah.
presentation, right?
Oh,
Me, as I said, I'm a yapper. If I had anytime I have like an oral component for my medical exams, it's no problem. But then I get to the written part and I do have a hard time. So it depends on your learning style and there are ways to assess this. There's formal neuropsychological testing, which can help you learn about sort of how you process information, what are your strengths, what are your weaknesses. You can then tailor your studying to that. And depending on what academic setting you're in, you may be able to request some kind of accommodations. So for people who process the information and material, they can do it more quickly in an oral way. We might say they would request an accommodation for more time or something like that. It's
I
not
see.
always to get the perfect, it's not always possible to get the perfect accommodation for your learning needs, but sometimes that can be helpful for getting folks over the hump because it is so sad to see someone who
Well, they know
knows
you.
the material.
Oh, yeah, for sure. Like those two, I mean those two examples, they'll really stick out because I'm like,
Yeah,
and I told them both. I go, there's absolutely no way that get out of there without a passing score. Like
yeah,
I was that confident, and I don't
yeah.
think it was like maybe a what's the right word, but it's not like I was just making it up to make them feel good because I've told plenty of
Right.
no, you got to go in the next cycle. Like this is
Okay.
not happening for you,
Yeah,
but it's interesting stuff. Now,
yeah.
as we wrap up here, I wanted to ask you, can you talk a little bit about both your book, but also,
Mhm.
what does it look like if if I have, test anxiety, and then
Mhm.
we're gonna presumably meet over Zoom, and if I'm not in the area, like what does that look like? And whatever one you want to address first, the floor is yours.
I'm sorry, say that second question again. You said, what does,
Okay. Yeah, like if I contacted you because I
oh,
want to
sure.
consult, like what does that look like? Do we meet
Mhm.
for an hour and then you're going to give me
Mm,
an exam, or what does
mhm.
a meeting with you look like? And please tell us about your book too.
Sure. So I'll start with the book. The book is available on many platforms, and I designed it to be pretty comprehensive. Not everyone is able to work with me one-on-one. Not everyone has the time or the resources, and so this book is really accessible and incorporates, the evidence-based practices that I was talking about. Cognitive behavioral therapy has excellent evidence for the treatment of anxiety and test anxiety. So it's got all those components that's going to work
Okay.
on calming down your body, working on your thought process, and then sort of a bonus that I can add with my background as a physician are integrative psychiatry techniques. So things like body movement, nutrition,
Ah,
aromatherapy, all of those kinds of things. And so that makes this book a bit different from one that might be written by a social worker or a psychologist, something like that, is that we're incorporating some of those elements. Um,
okay.
I also have a course, and so I'm going to sort of give you the different ways that we can work on this. Next up would be sort of the course, which includes a workbook, which has all these exercises and has 55 modules. So that self-paced, you can watch the videos uh, at your time and work through the material sort of in a more in-depth way than the book. And then if
Oh,
someone wanted to meet with me one-on-one, what I usually do is I start off with an evaluation because sometimes it's an anxiety and sometimes it's a learning difference, whether it would be ADHD or dyslexia, or there's difficulty with comprehension or processing speed. Those things I can ask some questions about those, suss them out a little bit, potentially make a diagnosis, and then if not, refer to a neuropsychologist who can make that diagnosis. And that's a good starting place if we're like, yeah, this looks like anxiety, or this looks like it could be something else. Um, and
okay.
then if it's the anxiety, we'll work together for 6 or 8 sessions, doing a more individualized work, but using still some of the techniques that are available in the book or the course.
Wow.
And it depends on your needs. So the physician that I worked with, we worked together for, I think, a period of 10 months, and it was once a month for a while. Then we increased to every 2 weeks and closer to the exam every week. And we were working through these techniques together over that long period of time to really get her ready. And let me tell you, she passed that exam with flying colors. She
Yeah.
passed that exam and she had the knowledge, she had the content.
Yeah.
I know
It's
she had the content, but it was sort of working through those mental blocks to help her to get through.
okay. Yeah, and it's like I said, I'm a huge sports fan and still participate. And it's like I love seeing these stories for if we use the NFL, playoff season as an example, like Sam Darnold up in Minnesota again.
Uh-huh.
As a state, like he was on the garbage heap. Like nobody wanted this guy, and then he gets paired up with the right, let's say, doctor, which is the coach. He's
Yes.
got the he's got a ideal situation around him, and the guy, numbers wise, was one of the best quarterbacks this year.
Yes.
It's like it was
Yeah.
always like you were saying, oh, for your friend, it was, or the physician was always here, whereas this
Yes.
guy was always here and it was always in the arm and the leg.
Yes.
He just needed a different route,
Yes.
to take. So that's
Yeah.
pretty cool. So the book is Test Anxiety No More. Students
Hmm.
can go to your website. Can you remind me what the website is?
Sure. So the website is collegepsychiatrist.com.
Okay, collegepsychiatrists.com or psych.
Yep.
Okay.
Collegepsychiatristsingular.com.
Okay.
So
I'll
you can
put
go there, and then there's a tab on test anxiety where you can learn more about the book. You can learn about the one-on-one sessions and then also the course. And then of course we're on all of the social media platforms, Instagram, TikTok, Facebook, LinkedIn. We have a Substack that we'll be releasing soon, and always having tips that we release there, manifestations that you can practice.
Oh yeah.
So that's also a really great resource for people.
Awesome. Well, my anticipation is that a lot of people with soon to be three letters behind their names now with the CFP will be contacting you.
Awesome.
I'm very grateful that you were on, before or that you came on. So I really appreciate your taking time out of your day. And at the end of the day, let's say
Mhm.
when you're meeting with a patient and he or she is struggling with test anxiety, let's say, or at least they haven't been able to perform well on the exam. Again, you're not here to give medical advice, but I have to
Sure.
imagine too that at some point it might be appropriate for, medication
Hmm.
or some help from another
Right.
professional that has a particular, maybe it's a student, and I don't know if you deal, if you specialize in working with, I'm just going to make it up, but let's say somebody with ADHD,
Hmm.
refer that person to one of your colleagues if they need some additional help that somebody else really specializes in. I
Hmm.
those sort of cases.
Yeah, and so that's, I have sort of at the end of everything, it may be that you do need a little bit of help with medication, and that can
Hmm.
be a medication you take just before your exam. That can be a medication you're taking on a daily basis. It just depends. And that, that's my specialty. So I'd encourage people to schedule an appointment, and we can do that evaluation and see what plan might work best. If it's ADHD, depending on where the person lives, um, those are medications evaluation that I can complete generally. And then if not, I refer to someone who can, but if they need then the medication, that's something to prescribe as well. So
Okay.
there's a lot of help, and I see so much hope for people. And I think the
Yeah.
saddest thing is to see the potential that people have because they're able to access the knowledge and work hard, but this exam just prevents them from moving forward. And this is my whole purpose. I'm very passionate about it.
Excellent. Well, that's the thing too, is that of all the students I've worked with, either in a classroom or one-on-one or in a review course setting, honestly, I have to say I have not met one where where the cognitive ability was just not there.
Hmm.
Everyone who's sitting for the exam, it's the same thing for your medical exam. I don't think you probably ran into anyone I guess that were taking medical exams where you're like, man, this guy or this lady has no shot whatsoever. It's just
No.
like getting that information in is one thing, and
Yeah.
then getting it out, it might be blocked or rerouted because of some
Yes.
anxiety or
Oh, I
some.
like that, Sev. I like that.
Oh yeah, it's interesting. See how much I picked up from you, but well,
Yeah.
what we'll do for everyone listening, I think I may have mentioned it, but we're gonna put up a link to your site. So if any students
Okay.
would like to seek out help, and I always have to mention to the listeners that studying is a significant commitment. There's no question about it.
Mhm.
So you've got to make sure, the students, you have to make sure that you're hitting the books, doing lots of practice questions, tons of practice questions. And if you haven't done so already, subscribe to our YouTube channel. That's at Pro Exam Tutors, for videos and other tips. And then also, I want to remind everybody that if you found this information to be helpful, which I definitely know that you did, please let us know with a like and a comment. Yeah, I always love hearing from you guys. And if you know somebody or a study group that can benefit from this knowledge or other knowledge that's out there on our channel, just please be kind to them by sharing this. So, with that said, again, Dr. Busch, I appreciate it. I know everyone listening definitely appreciates. We've been waiting for you for quite some time. It was just a matter of getting all the stars aligned, or it's also called Thanksgiving, Christmas, and New Year's. Kind of gets in the way. Now throw in a daughter's birthday a week after
Oh
New Year,
man.
a wife's birthday after
Oh
that.
man.
We do Christmas on the 25th, also Little Christmas on January 6th. So sorry.
Oh
That's
man.
my apologies to everyone out there and to you, Dr. Busch. We got a little bit sidetracked, but
That's
in
okay.
January we're back in business. So
Yes. Okay,
thanks
awesome.
again, and we'd love to have you back in the future.
Thank you so much.
All right, thanks. Take care.
Thanks for listening to this episode of the Earn Your Marks podcast. For more information or to get in touch, visit us at proexamtutors.com.